Welcome to the Crescent City, where Vital Options is in New Orleans with ASH, the American Society of Hematology.
I think the takeaway message is it is a time of great hope. I mean, there has been amazing advances. We're hearing about them every day. It's a wonderful time, and as you said, there is collaboration going on between organizations, between community partners, between physicians, regulators, in fact, as well. Have a new openness and a new sense of collaboration, and I think we appreciate that, and I think it's important for our patients to hear that message, to really understand that this is an amazing time, and we are coming together and remembering that they're at the core of this, and we share their urgency and their passion and really have made a tremendous difference.
I think there was probably a time when blood cancer patients felt very much alone at the time of diagnosis, and I would say all three of our organizations have done an amazing job at providing resources so that no member of our community needs to feel alone. There are resources out there that can help prepare them, educate them, and support them throughout their entire journey.
For the MMRF, our mission is about accelerating new treatments and a cure for patients, and that has been the same for 15 years. And we have seen, the community's seen tremendous progress in terms of new treatments and doubled survival and a much better understanding of the disease. And, you know, we're not there yet. So despite the progress, we're not there yet. But there's such momentum, as Dr. Stewart said earlier, we're in the midst of a revolution. And the message that I really want to get out there is patients have such an ability to be involved today, to know your data, to share your data, to join clinical trials, to ask your doctor about what type of, not only myeloma, lymphoma, leukemia you have, are there treatments specific that could benefit you specifically? Be much more proactive. It's not about questioning your doctor, it's about getting the treatment and the care that's right for you, and patients have the ability to drive that.
Well, I was going to echo Anne's comments, which are just for patients to get involved. Go and see somebody at a specialized center, even if you're going to get treated close to home, so you have all the information you can get. Participate in clinical trials and in tissue banking studies to help yourself and gain knowledge and help others. And lobby. The NIH funding is being cut regularly. Contribute to the organizations that are here today and get involved.
And I would imagine one message that we want to tell patients is sort of know your genome. You know, it's such an amazing thing that we can sort of map our DNA, understand the genomics that make you you, because I would guess that if you have that information and someone else in your family gets diagnosed, that genomic information is very relevant and valuable.
Yeah, you know, I was just thinking as you were talking, we've got to be careful to differentiate between the genome you're born with and the genome that's part of your cancer. And what we're talking about is really the genome that's part of your cancer, not so much hereditary mutations, which you might also learn about, but each cancer genome is unique, it's different from the genome you were born with. That's what you need to understand.
But when you know that, is that not relevant to a subsequent family member?
No, usually not, unless you discover that you have an inherited predisposition to develop malignancy. And sometimes we turn it up. When we sequence the genome, we learn everything about you, and we do sometimes find, you know, you have a gene in your family that is predisposing you. That is important information, but we don't always find that.
Thank you, all of you, because you are working in a most exciting time. We wouldn't have had this discussion 20 years ago.